So good morning.
Good morning, Dr. Singer.
And your name is?
W. Scott McCormick.
And it's okay to videotape you?
Sure is.
And if I put this on my website or Facebook, that would be okay?
I'll be a star.
There, you will be. You are a star. So you were born with an abnormal valve that's known as a bicuspid valve, and it became blocked. We call that stenosis. And the recommendation was that you needed a valve replaced.
And a full sternotomy.
And that you went for a couple opinions, and most places suggested a full sternotomy. Then you came to see
Dr. Tuluca.
You came to my partner, Dr. Tuluca, for a second opinion. And what did Dr. Tuluca perform?
She performed minimally invasive heart surgery right here.
About a 3-inch incision just to the right of your sternum.
Yes.
And it was a couple of days ago. And do you have any pain?
No pain at all.
And
very little.
And it's been 3 days and you're ready to go home.
Yes.
How was the care here at
It
Einstein?
was very good.
Care was good?
Yes.
All right. Well, we're glad you're doing well. It looks like your pillow's been signed by everybody here.
Everybody, even the maintenance people.
We're one big we really are one big family here. All right. Well, it was really a pleasure to take care of you, and we'll see you soon.
All right. Thanks, Doc.